Going to be just fine.
We're going to be pretty soon at only 5 people, and we could be at just 1 or 2 people over the next short period of time. So we've had very good luck. It's going to disappear. One day it's like a miracle. It will disappear. No, I'm not concerned at all. No, I'm not. No, we've done a great job. So it could be right in that period of time where it washes through. Other people don't like that term, but where it washes through.
Some people did note that your tone seemed more somber yesterday. You talked about that August timeline. Did you see a projection? Some people thought perhaps that 2 million potentially that could die maybe prompted part of that. Was there a shift in tone?
I didn't think, I mean, I have seen that where people actually liked it, but I didn't feel different. I've always known this is a pandemic. I felt it was a pandemic long before it was called a pandemic. All you had to do is look at other countries. I think now it's in almost 120 countries all over the world. No, I've always viewed it as very serious. There was no difference yesterday from days before. I feel the tone is similar, but some people said it wasn't.
So even if for some reason he did know about this, it begs the questions, why didn't he order the federal government to do more sooner, especially on testing? As the New York Times notes, the mayor of Seattle wanted mass tents from the federal government to rapidly build shelters to house people in quarantine. By the way, every scientist we've spoken to on this show and doctor says that is a really important, good idea, and it's not happening. The state of New York pleaded for help from the Army Corps of Engineers to quickly build a hospital. Oregon's governor repeatedly pressed the Department of Health and Human Services for hundreds of thousands of respirators, gowns, and gloves, face shields, goggles, anything. Hospital ships remain at port. The Department of Veterans Affairs, legally designated as the backup healthcare system in national emergencies, awaits requests for help. The National Disaster Medical System, a collection of emergency doctors and nurses ready to be deployed by the Department of Health and Human Services, is also still waiting for orders. Per the Times, even after Trump committed to supporting states on Tuesday, the Army Corps of Engineers says it still had not received direction from the administration. And even the Defense Department, home to over 1 million active duty troops and a civilian and military infrastructure that has made planning for national emergencies almost an art form, has yet to be deployed to its fullest capabilities. Joe, the bottom line here is there are things that can be done to mitigate disaster,
right,
to mitigate hundreds of people infecting thousands of people in our healthcare system.
Right.
No triggers have been pulled.
Right. And you know, it's great that they're having the press conferences every day. It's great that they're doing what they think they should do to update Americans every day on our response. But we have such a long way to go. Again, I agree with Stephanie. OK, if we don't want to talk about what's been done in the past, let's talk about what's happening right now.
Well, he needs to do that and not rewrite history in these press conferences.
Right.
This is not about him for once and for all.
Right.
For once and for all, this president needs to face the facts. And I don't know who can get through to him, but this is not about him.
Well, so what this is about is we've got over 300 million Americans that don't know whether they have coronavirus or not, do not know how the pandemic is going to impact them or their communities. And we are, as one of an ambassador who's an ally to the United States, told me, you all are flying blind. You don't know what's going on. And Jeffrey, I think that's still the grave concern. We still really haven't gotten a straight answer. And I will go back to the foundational question about the testing. Our scientists don't know how to map this out. Mathematicians don't know how to map this out. And you have, again, all of these agencies that are waiting to be deployed. But yet you look at the Department of Homeland Security, for instance, and it's been gutted over the past 3.5 years because a remarkably large number of positions have not been filled.
Right. Well, you know, look, a couple of points here. The first is that if the president thought it was a pandemic, before we were using the word pandemic, we would not be here right now talking this way and looking at the problem that we have right now. Period. End of story. I mean, if the President of the United States had taken this seriously and understood what it meant to be in a pandemic 2 weeks ago, we wouldn't be here. You know, and this is why history is important, because you'd like a president, you'd like a chief executive to study past disease spreads, Ebola, H1N1, SARS, right? You would like a president to study the inadequate government response to natural disasters like Katrina, and so talking about and holding him responsible for this is very important. But here, this is a basic question that you would like a president of the United States to wake up every morning and ask. How many people are sick? How many people are being tested today? Right? I mean, that's a question that could have been asked a month ago, even if he hadn't believed, as he now says, that it was a pandemic. Right? It's the most basic question of all. What are our tests showing us? Where is the spread? What governors, what mayors do I have to work with today? Where do I surge supplies to? How do I use the full force of the U.S. government? And yes, your point is actually right on point. You know, it's harder to move the vast apparatus of federal government when so many jobs are empty. But again, that's just another aspect of a governance problem that we have right now. And so holding that accountable and not letting him get away with saying, oh, I always knew it was a pandemic, that's part of journalism, and that's part of how we stop this from happening the next time.
Well, so, Willie, here's where we are right now. It is a pandemic. The president knows it's a pandemic. All the president's men, all the president's women know it's a pandemic. So the questions that we need to ask this morning are, what's going to be done today? What's going to be done so you, Willie, can actually, if your family or someone you know and love thinks they may have the coronavirus, how can you get that in less than 6 or 7 days? If somebody that I know or somebody watching out there has a mother or father or a grandmother or a grandfather who may have the coronavirus, or worse yet, not worse yet, but just as dangerous, if somebody in their teens or 20s may have the coronavirus, and we want to make sure they do not infect people where contact kills. How do we find that out? And then beyond that, how do we start actually using the power of the federal government to do all of those things that it's not doing right? That's what listen, we're going to debate what the president knew and when he knew it this fall in the election. Right now, I can't say this strongly enough. We still have a chance to bend the curve. We still have a chance to avoid the fate of Italy. So every day is a brand new day and a brand new opportunity to get this right. I mean, we've made a lot of mistakes, and yes, Americans are paying for those mistakes. But how do we avoid the grave tragedy? How do we avoid the Italy model, Willie? And that's what I think this White House, needs to do a better job just assuring Americans that they get it, and they're going to deploy the full power of the federal government. And if they need to get tests from the World Health Organization so scientists can map this and we can keep our families safe, then damn it, do it today.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.